do a number of different procedures here, but one of the ones we do most frequently is a coronary angiogram or heart catheterization. That's a procedure where we take a small catheter. Here's an example. It's generally just a few millimeters across, and insert that into the artery. Most often we actually go through the artery in a person's wrist and take the catheter up to the heart to take pictures of the arteries of the heart. We do this oftentimes because we're afraid somebody has coronary artery disease or a blocked artery to the heart, or they've actually came into the hospital with a heart attack. And once we get in there, we can diagnose what the problem is and then come up with the best solution to treat it. Oftentimes, through that same catheter, we're able to insert a device called a stent, which is a scaffold that opens up the blockage and keeps the artery open. A lot of my patients are really shocked to find out that they actually are awake or just a little bit of sedation for the procedure. And we do that for a number of reasons. One is because there's very minimal pain involved, so there's no reason for general anesthesia. And also it makes it safer. I want to be able to communicate with them. As I said, it's essentially a painless procedure, so if they're having pain, I want to know about it. And that way we can communicate with each other. When we do the heart cath or the angiogram, people say, well, how do you see inside the artery? Is it because you're taking a video or is there a camera? And actually what we do, the patient is laying here on the table, and this machine is actually an X-ray machine. So up here you have X-rays which come from below and are actually absorbed into the camera head. And through this catheter, we actually inject iodine contrast that allows us to use the X-rays to take very detailed pictures of the arteries. Here's an example of a person's artery that goes to the right side of the heart and the bottom of the heart. And you can maybe see there a little catheter coming in, and then the contrast fills up the artery, allows us to see the blood flow going into the heart in real time. Once we've done that, if we do find that somebody's had a blockage, through that catheter we advance a very tiny wire. The wire is actually like a thick hair almost. We can advance that into the artery past where the blockage is, and then over that wire insert a device that I described earlier, a stent, which allows us to open up the blockage, immediately sometimes relieving the chest pain or symptoms that patients are having.